Okay, hi, good morning. We're going to get started. If everyone could raise their hands and let me know that you can hear us, that would be great. Perfect. Okay. All right, so good morning. This is Rebecca Jacobs, and I am one of the two public health nurses at the State Program Office for the School-Based Health Centers. We also have Karen.
Hi, my name's Karen. I'm the other public health nurse here at the State Program Office.
And so together, Karen and I do the site reviews and provide technical assistance. We also have with us today Kate.
Hi, everyone. This is Kate O'Donnell. I'm the school mental health specialist with the program, and I oversee the mental health expansion grants. Special welcome to all the mental health grantees who are joining us to learn about the program today.
Great. And we have Kwong running our webinar, and you will hopefully meet him at the coordinators meeting on October. Yeah, so our hope is by the end of the presentation, you have a better understanding of how the state SBHC program and SBHCs work together to support youth in Oregon. There will be time for questions, so please go ahead and write the questions in the comment box as we go through the webinar. So as Kate said, special welcome to all the mental health expansion grantees today, and also to the new coordinators and new staff. So our objectives today are to provide a brief overview of the adolescent and school health unit here at the state, an overview of Oregon's SBHC model with examples of youth-focused care, and then identify some resources. We will also talk about State Program Office, or as I refer to it, SPO, and Karen might refer to it as SPO, so SPO
or whichever way
SPO.
It comes out.
So the requirements for certified SBHCs going into more depth to discuss data requirements. Okay, so our adolescent health school unit. So the SBHC SPO office sits in the adolescent and school health unit, which is part of the Oregon Health Authority's Public Health Division. Lots of words there. The programs in adolescent and school health include the School-Based Health Center program, Health Policy and Assessment, School Nursing, and Youth Sexual Health. A few examples of the ways that these programs work closely with each other are we track legislation that impacts youth, support positive youth development, and consider ways that school nursing and SBHCs can work collaboratively in a larger health system in a school. So in total, the adolescent and school health unit is a group of 16 individuals that work to support all youth and adolescents in Oregon. Our vision is that Oregon is the very best place for all youth to learn, grow, and thrive. And our mission is to support the health of all youth in Oregon through evidence-based and data-driven policies, practices, and programs. The SBHC State Program Office, our program office, the SBHC State Program Office, is a total of 9 employees, and we refer to ourselves, as I said before, in short, SPO or SPO. The main functions of our state program include the certification work. So we work to ensure and monitor compliance of the state standards for certification, technical assistance, policy and program development, data collection and analysis, and then funding. We provide base funding to certified sites, mental health funding as competitive grant money, and at times we have funding for special grants or projects. So some of the things that we have funded in the past are planning grants for communities exploring and opening a new SBHC, purchases of iPads, grant money for clinic supplies or youth-friendly engagement work, and grant money for professional development and training of SBHC staff. So let's move on to talk about the school-based health centers. So here are some photos of SBHCs around Oregon. As you can see, they look very different depending on community, need, and capacity. SBHCs are unique healthcare models for comprehensive physical, behavioral, and oral health services provided to youth on school grounds, thereby helping them miss less class time and remain healthy and ready to learn and thrive in the classroom and beyond. SBHCs are different than other clinics because they provide population-based, adolescent-centered care that is both youth-friendly and follows comprehensive best practice guidelines. Some characteristics of SBHCs are that they're integrated in schools, built on partnerships, youth-centered, and convenient for students and parents, and accessible and effective. No student shall be denied access to an SBHC due to insurance status or ability to pay. And therefore, SBHCs have the potential for decreasing disparities in healthcare delivery because all youth at the school have easy access to the SBHC. So in numerous studies nationwide, SBHCs have been shown to improve health-related outcomes, and use of an SBHC is associated with increased use of vaccination and preventative services, reduced asthma morbidity, fewer emergency department visits and hospital admissions, higher contraceptive use among females, improved prenatal care and higher birth weights, lower illegal substance use and alcohol consumption, and reduced violence. And so also numerous nationwide studies have conclusively linked SBHC use to improved educational outcomes. So the use of SBHCs is associated with reduction in rates of school suspension, higher high school completion, increases in grade point averages, and increases in grade promotion. And there's a link to the studies there that you can see on the slide. So as of July 2019, we have 78 certified SBHCs across 26 Oregon counties. And of those 78 certified SBHCs, 73% of them are sponsored by FQHCs, 50% are state recognized as patient-centered primary care homes, 68% are located in primary care health professional shortage areas, 19% have a dental provider on site, and 100% of SBHCs have a mental health provider on site. Yay! Okay. So as we await the data for the 2018-19 school year, we have the visit data from the 2017-18 school year. And the breakdown of visits is as follows. 59% were primary care visits, 39% behavioral mental health visits, and 2% dental visits. And these percentages are for clients ages 5 through 21. We know that some SBHCs see youngers and olders, but that's the data for 5 to 21. In the next few slides, we're going to move on to talk about funding. Counties or medical sponsors with certified SBHCs are eligible for base funding from our program. Each SBHC receives $60,000 a year in base funding. So this year we have the new first right of refusal for the funding. Due to a policy change starting July 1st, 2019, local public health authorities, or LPHAs for short, are now given the first right of refusal for SBHC contracts with the state. So LPHAs with certified SBHCs choose to either manage SBHC state program office contracts and receive state SBHC funding. So that's operating similar to the previous policy. Or have the SPO contract directly with non-county medical sponsors, and therefore the funds go directly to the medical sponsor. If the LPHA is not the direct recipient of the SBHC funding, the LPHA would not be accountable for contract requirements, including contract monitoring and oversight. So what does this look like? With the new policy, there are a few ways the state SBHC program funding can flow. The first example on the left, the funding can flow from SBO directly to LPHA, and in these cases, the LPHAs are the ones operating the clinics. In the middle example, funding can flow from SBO directly to the LPHA, which then subcontracts with other entities to operate the SBHC. So for example, an LPHA may contract with an FQHC and contract with a community mental health provider to provide primary care and behavioral health services. Or what is new is the example on the right, where funding flows from SPO directly to the medical sponsor agency. If the SBHC received mental health expansion grant dollars, that funding also goes through the medical sponsor. Yeah. So if you have any questions about the funding, Rosalind's the one that did all the contracts, and we can certainly punt questions to her. So I'm going to let Kate go ahead and talk about the next few slides.
Thanks, Rebecca. So I'm going to talk a little bit about the mental health expansion grant funds, which most of you should hopefully be a little familiar with. So these first became available in 2013. We received $4.6 million from the state legislature to support mental health services in our clinics. At the time of this initial investment, less than 50% of all of our clinics had any level of mental health services available on site. So this initial investment has grown over the years. During the 2019 legislative session, that number has increased to $7.5 million that is being used to support mental health services in our clinics. So as you can see on the chart on the right, when that initial investment kind of hit, the number of behavioral health visits and clients has really kind of skyrocketed among clinics, which has been so wonderful and such a huge sea change for SBHCs around the state. And at this point, 100% of our clinics now have a mental health provider on site. We anticipate for this next biennium, the grants follow the 2-year legislative budget cycle. We'll be funding at least 48 FTE in 62 school-based health centers in 27 counties. And we also support, a smaller amount of money goes to support youth-led projects to help decrease stigma around accessing mental health services. Next slide. So the way that these dollars are allocated is pretty complicated. Like I said, it follows the 2-year grant cycle, the 2-year budget cycle. So we're currently in the 2019-2021 biennium. Applications for the current grant cycle closed in spring 2019, and we'll begin our next funding cycle in spring 2021. So that's kind of an open process. Funding is awarded to previously funded sites via a funding formula. So that's that box on the left, which is based on several factors to determine unmet mental health needs. Previously funded sites, as well as sites that have not previously received mental health expansion grant funding, can apply for what we call pooled funds of up to $50,000 per site to support mental health services at the SBHC. And so the funding formula award plus the optional pooled funds, that's what equals your total award. There's actually a lot more that goes into this process. It's complicated to explain. We actually did a full webinar just on this process that's available on our website. If you'd like more details about what that looks like, we'll have our website up soon that you can just click into the webinar section and get more information about that. I am also more than happy to answer questions that you might have about that process. Type in questions into the question box if you have them now.
Oh, okay. So there's a comment that the audio went off and the volume is way lower. Can people still hear us?
Yeah, could you raise your
hand?
Can you hear us? Oh, people can hear us. Okay.
Okay. It's back working. Okay. Phew. Okay.
Any other questions specifically about the funding or kind of some of the basic stuff that Rebecca went over? Great.
Okay.
There will be more opportunities for questions.
Yeah. All right, we'll keep going. Great. So we're going to talk about the standards for certification now. We're not going to address all the requirements as they are spelled out in the standards. Instead, we're going to go over some of the high-level requirements to help you better understand the certification model. We'll go over some of the main roles, the standards themselves, site visits, waivers, and data requirements. Again, it's a high-level review. And just a reminder that all these requirements apply to all agencies providing services within the SBHC, and that includes behavioral health and dental providers. So what is certification? The SBHC model in Oregon is outlined in what we call the standards for certification, which are written into Oregon Administrative Rules, or OARs. And then these rules establish the procedure and criteria that the Oregon Health Authority uses to certify, suspend, and decertify SBHCs. These rules also establish a clearly defined SBHC model and standardizes SBHCs across Oregon. One of the goals of certification is to increase evidence-based practice and maintain quality improvement. And certification is a voluntary process, and only the sites that meet this model are eligible to become a state certified and receive funding from the SDO. A copy of the standards is available online. The link is on the slide, but we can also get you hard copies. We do usually bring them around at site visits. But if you would like them, you could certainly let us know. So the role of the sponsoring agency, it is an entity that provides an SBHC with or contracts with another entity to provide one or more of the following: funding, staffing, medical oversight, liability insurance, billing support, and space. The medical sponsorship requirement shall include medical liability coverage, ownership of medical records, and medical oversight. Okay. So the SPO requires each site to have a designated site coordinator employed by the sponsoring agency, and the responsibilities of the site coordinator are many. They include serving as the primary contact between the SBHC and the SPO, help keep the SBHC in compliance, and also notify SPO when they are out of compliance. Prepare for and attend certification visits, submit required data, keep the operational profile up to date, attend our meetings, and then forward communications to others within the SBHC. The standards for certification, the book that we talked about, are divided into the sections noted above, and each section outlines the specific details to the certification process. So one of the important standards that we're going to talk about, operations and staffing. The standards say the SBHC must be open and offering clinical services a minimum of 3 days a week when school is in session. Clinics must also be open for services at least 15 hours a week with availability for same day and scheduled appointments. Many SBHCs are open during the summer, but since school is not in session, we do not hold the SBHC to the minimum hours. The standards, oh, whoops, sorry, next slide. No, you're good. So the minimum staffing requirements in the SBHC, the office health medical assistant is working 15 hours a week. Some SBHCs have a person in each position, and some just have one person doing that work. So 15 hours a week. A primary care provider working 10 hours, splitting those hours to be available 2 days a week. That looks different among different clinics. It could be 5 hours one day, 5 hours the next, something like that. And then also have an additional health professional working a minimum of 10 hours a week. And on the previous slide, I think you talked about what those were, but yeah. Okay. So the goal of the SBHCs is to provide pediatric health care in line with nationally recognized standards of care, including recommendations from the American Academy of Pediatrics Bright Futures Guidelines to determine age-appropriate levels of service and strengths-based approach. Bright Futures sets the gold standards for what screenings and services are recommended at what age. And when Karen and I observe well child techs at site visits, we use Bright Futures as a way to evaluate youth-centered age-appropriate care. So some examples of things that we would expect to see is annual STI testing, depression screening starting at age 12, immunization screened and offered at all visits, sick and well, youth-centered care with anticipatory guidance, and integration with mental health. These 2 pages can be found in our current standards, and they list the minimum level of comprehensive pediatric health care that must be available either on-site or by referral. It's a busy slide. but it's in our book. Okay. Okay, so the site visit. So sites attest that they are continually meeting the standards for certification, from the application for certification to the annual completion of the operational profile. The site visit is one method that we use to verify this, that the SBHCs are meeting those standards. Site verification visits in general occur within 1 year of a new certification application, although we try to get there sooner than that. And then every 2 years for a representative sample of SBHCs in the system. So for example, if a medical sponsor has 5 SBHCs, we'll visit 2 1 year, 2 1 biennium, and 3 the next biennium. Our goal with site visits is to support the SBHC to provide the best care possible for organs use. And then the site visit is also an opportunity for the certification team to provide technical assistance to SBHCs and help further support quality youth and adolescent care. Verification tool. So this is the review tool that guides our site visits. Sites should be using this review tool to prepare for the visit and check compliance throughout the year. Site visits work best when the SBHC has filled the tool out on their own prior to the visit. That way we can both sort of know what to expect. So site visits are done by myself, Rebecca, and Karen, and are typically start in the morning and take most of the day. We would highly encourage all SBHC staff, including behavioral health staff, to be available on the day of the visit, especially for the debrief. We like to talk to as many partners that can be available so that we can assess for integration and provide technical assistance recommendations. And at the end of the site visit, we hold a debrief meeting. This is an important opportunity for the SBHC to talk about all the great work they do and provide examples of how they meet the standards. It's also a great opportunity to ask us questions, hear about site visit findings, and network with SBHC partners. So all sites should have a certification binder, and in that binder should be the MOUs between all partners associated with the SBHC, and then the 10 required SBHC specific policies. We know that many sponsoring agencies keep electronic copies of these stored somewhere, but we still would like to see the hard copies available in the binder. Current staff can have easy access to the basic policies and procedures that shape the SBHC. So within 2 weeks of the site visit, you will receive a site visit report. The report is broken into a narrative portion and an action item portion. And on the slide, you can see some of the, you can see sort of our outline for what we do with the narrative portion. Okay. So for findings that are out of compliance with the standards of certification, there will be an action item with an agreed upon plan to fix the item. It usually entails sending us a photo of a corrected item within the deadline frame, which is typically 30 to 90 days. There's an example of an action item. Our certification plaque, when the SBHC becomes certified, they'll receive a plaque to hang on the wall and then get a new sticker every biennium. So when an SBHC becomes out of compliance at any time, they will need to submit a waiver through the operational profile. SBHCs must notify the program within 20 calendar days of any change that brings the SBHC out of compliance. An example of a waiver would be that, let's say, a primary care provider retires. It takes more than 20 calendar days to fill that position. A waiver for lack of primary care hours would need to be submitted, and then we will approve or deny that waiver within 2 weeks. It's a team decision. We look at all the waivers together. The waiver must include an example of the non-compliance, a plan for corrective action, and a date for meeting compliance. And then we closely work with the sites during that process and expect the site coordinator to keep us updated regarding process on the waiver. I believe, Kate, are we? Oh no, is that me still? Hang on a second. I lost it. Hang on. Oh, Standards for certification other. There it is. So there's always a potential for changes to occur at a school-based health center. This is a list of items that we ask to be notified about as early as possible so that we can all be good stewards of the state funding money, and then we can also provide support. Our program also has internal policies and timelines for SBHCs to follow should any of these changes occur. And please, please, please let us know if the site coordinator changes. There are many things we can do and tools we can provide to help in the process. And then now, Kate.
Now. Okay, so I'm going to talk specifically about, we have an additional set of requirements for our mental health expansion grant. These expectations were outlined in the letters, the award letters that you all received in July 2019. So hopefully they're not a surprise. If you are on this webinar today, I'm guessing that these are not a surprise to you. But as you may have gathered from what Rebecca said about our standards, they are largely silent on behavioral health. Mostly because the SBHC model in Oregon was very primary care centric historically. And as I said earlier, up until very, very recently, many of our centers did not have any mental health services available at all. So it was difficult for us to outline requirements in our standards about services that many centers weren't providing. So in attempt to kind of recognize that folks are providing these services now and to kind of encourage things like integration between primary care and behavioral health, and to kind of help us raise the level of expectation for the types of services that are being provided. These grant requirements are being introduced for the first time during this current grant cycle, so the 2019-2021 grant cycle, to really support quality behavioral health services being provided in Oregon SBHCs. We are looking also at revising our standards sometime in the future to kind of institute some of these things, and we'll keep folks updated as that happens. One other thing I should mention is that these requirements were developed with the support of an advisory committee of SBHC folks and behavioral health folks to kind of help us think about how to move the needle on these services, but also be things that were achievable for people. So you can kind of see that on the list here. I won't read through all of them, but it kind of outlines what the grant dollars are being used for, some of the other requirements that are aligned with our standards. So like the data requirements, which we'll go into later a bit more, but those data requirements do include twice annual encounter data submission, as well as a KPM audit, satisfaction survey, and financial audit entry. We are asking also new for this year that if you have an extended vacancy in grant-funded positions, that you notify us within 20 days. And so extended vacancy is like a medical leave, maternity leave, someone resigns kind of unexpectedly, and there's a gap in service. So please notify us if that does happen so we can kind of keep track of those vacancies. It happens, we get it, we just want to be aware of when it happens. You're required to participate in this very orientation webinar. I think if you hit the thing, yeah, you did it, yeah. So check mark on that, thank you for participating. And then to participate in check-ins and site visits. So as Rebecca said, there's the debrief. Karen and Rebecca really do try out to also meet with behavioral health providers during their site visit, just to see how things are going, to see what support that they can provide. Next slide, please. Then we also have kind of more soft requirements around like providing inclusive and welcoming service for diverse youth. We do ask that folks prioritize services to school-age youth. Some centers only serve the school, but many centers also serve the community. So in those cases, we ask that you prioritize services for youth of school-aged. All centers must have a strategy to ensure access to these services regardless of a student's ability to pay. So that includes uninsured, Oregon Health Plan, and privately insured clients, includes co-pays. So making sure that all students are able to access the services in some way on site. We have a couple of requirements about integration, both within the clinic and then with the school. So have a strategy to work with the primary care provider if the agency is different, and then along with the medical sponsor to support a relationship with the host school so that you're working with them on things like getting kids in for services, thinking about referrals in cases of crisis, how is the school looped in, kind of those kinds of things to kind of start making the clinic more integrated into the school. And then many of you, if you're community mental health programs, should know that there are requirements about reporting known suicides to OHA's Health Systems Division, which is the Jill Baker, who is the Suicide Prevention and Intervention Coordinator, so that we're tracking those kinds of things. Any questions? Looks like we got a few. Do you have any knowledge about legislative funding for the future? So are you specifically referring to for behavioral health, Elizabeth, or are you looking for like in general services? I think right now I would say that the state budget cycle in general, but certainly behavioral health services. Thank you for clarifying. So we do have an open request for proposals right now to fund new either clinics or school nursing services. That is a funding opportunity that was opened up with funding this legislative cycle. If you go to our website, healthoregon.org/SBHC, there's information about that, and that's to kind of help support school health services in communities that don't currently have a school-based health center, or maybe need support with school nursing services. A lot of our funding usually comes at the beginning of the legislative grant cycle or funding cycle, so we would probably know about that in like 2021. We'll start to get more information. But this is also, you know, we'll definitely try our best to keep folks in the loop when those things kind of come up. But as of right now, we don't know of any additional funding specifically through our program. There is also the Student Success Act, which was passed in 2019, and that does allocate funding specifically to school districts. A portion of that money can be used to support school health services. We're going to be talking about this a little bit more at the coordinators meeting, but we would really encourage folks to get in touch with folks at their local districts and local schools. Each school district right now is engaging in a school needs assessment process to look at where they could be using the dollars. And if you have ideas about how you could be better supporting health services in your school and district, this is a great time for school-based health centers, for youth action councils, and clinical staff and partners to be kind of plugged into those conversations. But those dollars are going through the Oregon Department of Education and not through our agency. But if you have questions about that, we're also happy to chat and maybe strategize with you. Example of the site coordinator account. Do you want me to read the question? Yeah. The question is, do you have examples of site coordinators roles for counties with more than one medical sponsor?
So the medical sponsor, so the site coordinator is hired by the medical sponsor. So each of the SBHCs in a county would have, if they're run by a different medical sponsors, they would have their own site coordinator. So is the question, I don't know, is there more to, can you explain the question better? It's more like how you work with school-based health centers in a county that have different medical sponsors. Am I understanding that correct? Medical sponsor? Yeah. Okay. Perfect.
Yeah. So just to clarify, so the medical sponsor hires the site coordinator.
Yes. Yeah. So you may, like Elizabeth, it sounds like maybe you work with different site coordinators because you work for a county that has different medical sponsors within the school-based health centers. Yeah. Okay. And then will this be recorded? Yes, it will. So if you came on late, I don't know when do we get it online?
Usually within a couple weeks after.
Okay. So it may take a couple weeks. If you have any questions, if you came on late and had any questions, just let us know. I think our emails will be up there. Okay, is that all the questions? Yeah.
Oh.
Okay.
Okay, this is Karen, and we're going to talk briefly about data and reporting requirements. So there are several data requirements that come with certification, and these include the operational profile, the annual operating revenue information, the key performance measures, the visit encounter data, the student satisfaction surveys, and the mental health expansion grant reports. So one of the roles of the school-based health center coordinator is to ensure that our office receives all of these data elements. And I'm going to provide a brief overview of each of these items. If you need more information on any of them, we've done a webinar, I think it was last month, that went over most of these in detail. So the operational profile. The operational profile is a way for our program to ensure that every school-based health center is meeting standards for certification. It's an online data system that each school-based health center system can access by having a unique login and password. In the profile, there are details about each school-based health center, including operations, staffing, shift hours, services, certification waivers, key performance measures, and financial data. The standards require that the operational profile be kept current and up to date, and the school-based health center coordinator is expected to update the profile as changes occur at the school-based health center, for example, if staff changes or shift hour changes. So the operational profile, when is it required to be updated? It's required to be updated at initial site certification when there's a brand new school-based health center being certified, by October 1st of each year, which is currently happening now, prior to your certification site visit, and then as changes occur during the year. An operational profile user's guide is available on our website. It has instructions on how to fill out the operational profile, and it's especially important to follow the instructions when you're deleting staff from your school-based health center. And again, as a reminder, we offer trainings once annually, it's usually in September, on how to use the operational profile, and the webinar recording from this year's training is available on our website. So the data requirement involving annual operating revenue. Certified school-based health centers are required to submit information about their annual operating revenue as part of the October operational profile submission. It's a retrospective data report for the previous service year of July 1st through June 30th, and it's due October 1st of every year. Key performance measures. School-based health centers are required to improve clinical practice around 3 areas. One is ensuring that clients ages 5 to 21 receive a well visit annually. The second is ensuring that the same group receives a comprehensive health assessment annually. And last, each school-based health center works on what we call an optional measure. Right now, the optional measures to choose from include adolescent immunizations, chlamydia screening, depression screening, nutrition screening, or substance use screening. So all school-based health center staff work together to raise these measures. For example, a mental health provider would ask a client if that student has received their annual well visit, and if not, coordinates for that student to receive their well visit. School-based health centers are required annually to perform a random chart audit and report on their KPMs by October 1st. Any physical, mental, or oral health visit for which the school-based health center currently submits data to SBO would be eligible to be included in the chart audit. And there's guidance documents on our website that outline the definitions and the requirements of each measure. Okay, the data requirement involving visit and encounter data. The standards for certification require that certified school-based health centers report all visits that occur at the school-based health center. Data collection and reporting requirements apply to all services, including physical health, behavioral health, and oral health provided on-site at the school-based health center, regardless of the age of the client. The visit data is useful to the school-based health center and to our state program office. We often take the data sent to us and format it in a useful manner that sites can then use themselves to market themselves, apply for grants, or to present information to partners on how the school-based health center is impacting the community. Visit and encounter data is submitted at a minimum by January 15th and July 15th every year. The data reported on January 15th includes the visits from July 1st through December 31st, and the data reported on July 15th includes all visits from July 1st through June 30th. Okay, data requirement around student satisfaction surveys. All certified school-based health centers are required to administer a student satisfaction survey that's developed by our office. And the purpose of this survey is to get a youth opinion on the services they've received at the school-based health center. Most school-based health centers, nearly all of you, administer it on an iPad. The survey should only be completed by clients ages 12 to 19, and that means no parents and no guardians should fill it out. And please only administer the survey one time each school year to a student. Don't ask the same student to fill it out multiple times. We send out a new iPad survey file every October, so be looking for this. The email should come from Loretta Jenkins, who's your primary contact for all things related to the iPad and the satisfaction survey. And in the email, there's an instruction manual on how to install the new file on your iPad, as well as a link to our website on how to download the new file. So school-based health centers are required to complete satisfaction surveys at least twice annually by January 15th and June 30th. That's when those need to be submitted to us. We recommend that you load your file on your iPad once you get it in October and submit test surveys right away to ensure everything's working well, and encourage you to begin administering the surveys as soon as possible and sync your completed surveys at least once a month. Each school-based health center is required to post language about the satisfaction survey in an obvious location in the school-based health center or online or in materials distributed to parents. And you can see the language here on the slide. This provides for notifying parents that students are being offered a survey. And you can find this language on our website in English and in Spanish. And Kate, do you want to talk about mental health data requirements?
I do. So in addition to the things that Karen just outlined, we have separate requirements for mental health expansion grantees. So we currently require narrative reports to be submitted to our office twice a year. So the next one will be due January 2020. I do try and give folks a good amount of lead time to get those in. So you'll probably see the questions for that report in November. And then once the school year is over, and then again in January is when we ask for those reports. And really the goal of those reports, it really helps us tell the story of the great work that you're doing. As you saw, all of the money for this program comes from the state legislature, and it's very helpful to tell them about the great work that you're doing, and I think that's helped increase the amount of funding that we've been able to provide to clinics with those stories. We also have been doing regular publications from our office, the status reports and status updates you can find on our website. And some of you may see those stories that you've submitted to us in those reports. They help, again, tell the story of the work that you're doing. They often also will have questions about things that we're looking to provide more support around. So how can we help you do your work better? Sometimes we'll ask questions about like the types of work you're doing. So suicide screening, for example, is a question that we've asked about in the past, or how you're working with schools. So it really helps us provide better support for you all. So we appreciate you taking the time to answer those questions, because I know that it can be a lot of work. We also ask that you submit mental health encounter data to our office twice a year. For some of you, this is the same thing that you've been doing for us for a long time. For newer grantees, it's a little bit more of a process, and we are here to help you with that. And so Loretta Jenkins is your main contact for those data submissions, and she's a great resource to help walk that through. But those are the dates for the data submission for mental health services. questions?
Oh, microphone
cutting out, no sound.
Can people raise their hand if they can hear us? Okay. Getting some hands. Okay, I'm getting some good hands. I apologize.
Okay, now, wow, it's cutting in and out, huh?
I apologize. I also maybe because I'm sitting
Oh,
outside the room.
okay.
Okay, well, if people have questions about mental health reporting, I'm also happy to take those offline too, if you didn't hear what I was saying.
I wonder if we should have our questions up on the side so we can see if people aren't hearing.
I think no, how it notifies you.
Okay.
Just leave it like that.
Okay, yeah.
Okay, now we're going to move away from data and discuss what makes your clinic valuable to youth. Not only are you a health clinic, but you're a state certified clinic because you know how to serve youth. You're in a school or on school grounds because you know how important it is to be where youth are. I'm going to quickly cycle through a series of examples from across Oregon that demonstrate ways that school-based health centers can be focused on youth. As you look at these examples, please reflect on your own school-based health center. What makes your school-based health center youth-friendly? How does your waiting room or office or exam room make students comfortable? What policies does your school-based health center have in place to ensure youth needs are met? How are your messages communicated to youth? Or how is your school-based health center integrated with the school? There are so many great examples across Oregon to demonstrate youth-focused clinics. Here, Youth Focus is a visually hip website at Bethel, letting youth know the school-based health center is specially designed for them. Is your website easy to navigate and eye-catching? Youth Focus is a flyer at Estacada providing information to students on how to access healthcare, and at the same time, the flyer provides reassurance to youth. The pink box literally comes right out and frankly says, if you don't have insurance, don't worry. We will still see you. Youth Focus is providing coordinated school health services at Milwaukee, where the school counselor, the school-based health center, and the school nurse are all on the same page. This helps meet the needs of students in a timely fashion. You'll see this sign on the left advises students to see the school counselor for certain reasons, like self-harming. In the middle, a student would go to the school-based health center for those reasons listed, like maybe a dental cleaning. And on the right lists the reasons to go to a school nurse for maybe like a headache. Youth Focus is integrating and working with the school towards common goals of keeping students healthy and learning in school. This social media post is on the Newport High School Facebook page, but advertises services provided by all 4 of the Lincoln County school-based health centers. This shows that the school-based health center is talking to the school to disseminate school-based health center messaging. Youth Focus is integrating mental health and physical health. The mental health provider encourages and refers students to well visits, while the physical health provider screens for depression and other mental health issues and refers students to the mental health provider. These are usually warm handoffs, which means students are referred to other providers while the student is still in the clinic. On this slide, Sandy provides a weekly coping group with yoga and mindfulness that is fully integrated into the school and offered to all Sandy High School students, not just students accessing the school-based health center. Youth Focus means the Sandy School-Based Health Center is accessible and properly signed. There are reserved parking spaces right in front of the School-Based Health Center, which makes it easier to park. Is your School-Based Health Center well signed in the parking lot and throughout the school? It's important to meet the needs of youth that are learning to navigate healthcare on their own. Meeting the needs of students also means that the Franklin School-Based Health Center is highly visible within the hallways of this school with this large sign. And a welcoming, bright, clean waiting room awaits the youth at Centennial. Youth Focus also means having cool, comfortable furniture that students want to lounge in while waiting for their appointment at Baker. And youth focus also means that the environment of a school-based health center serving only elementary students can be really fun and age appropriate. Jackson Elementary School has a hippo exam table. Youth Focus is a mural in the Milwaukee waiting room by a professional artist that's a graduate of the school. The mural speaks to the school community. And Youth Focus is also a mural by the Yak on the exterior walls at Marshfield. Go Pirates! Youth Focus is making sure the clinic is open before school, after school, and during the students' lunchtime, so that students can come to the Madras Clinic without possibly missing any school time. Youth Focus is reassuring students at Claxoni that privacy is important. These flip cards are available at the check-in counter, available for students to show the staff why they want an appointment, rather than possibly saying the reason out loud in front of fellow students in the waiting room. Youth Focus is a bulletin board at Roosevelt that changes regularly to liven up the space. Youth Focus is artwork on the LeGrand waiting room walls done by students themselves. Youth Focus is communicating that the Benson School-Based Health Center is a safe place for all. Are your staff trained on how to welcome youth to the clinic? Youth Focus is when you need a sign, make it count. This Roosevelt sign encourages students to take a survey. It's not a boring sign on white paper. It's a panda, and the message is that the student's opinion matters. Surveying students is important as we want to hear the youth voice. Do the staff at your school-based health center review the annual student satisfaction survey results together as a group in order to look at the results on how it relates to the students you serve? Youth Focus is promoting best practice strategies, such as the well visit, to keep youth healthy. Here, gift cards for a local market, gas station, and Amazon are offered upon completion of a well visit at La Pine. Youth Focus is making it easy for students at all Multnomah Student Health Centers to receive information, in this instance, by texting. Youth Focus is also easy to understand messaging for youth, such as a simple comic. All Multnomah Student Health Centers have TVs in the waiting rooms with the same standardized messaging, rotating the same at all 8 student health centers. Youth Focus is offering a variety of ways to get a message seen at Rex Putnam. When you stand back and look at your waiting room, how do you get messaging across to students? Have you asked youth at your school for ideas on how to effectively communicate with them? Youth Focus is providing a gender-neutral option for using an image of a toilet because Beaverton makes the school-based health center a more inclusive place for everyone. And Youth Focus is also about Franklin having a Youth Action Council, or YAC. Did you know that nearly half of Oregon school-based health centers have a YAC? YACs are student groups that are raising awareness and educating their peers about health issues. YACs are students advocating to make the school and community a better place. And YACs are students advising the health center on student health issues. What a great way to have a youth focus. And last but not least, Youth Focus means being on social media. Here, Benson is in tune with the students. Their Instagram post is encouraging students to come to the school-based health center during finals for a little chill time with a therapy cat. The post says, "It's almost finals? You've cat to be kidding me." I hope all these pictures have provided you with inspiration from examples of Youth Focus from around the state. You all are doing great work.
Okay, that was awesome. That was the first time I've seen that all the way through. That was really good. Okay. Now I get to talk about resources. So this is Rebecca again. Okay, next slide. So first, if you don't already know, you can find a lot of information about the SBHCs in Oregon and certification requirements on our website. Second, our office also has a single email address you can use to contact the SBHC team. So the entire office will receive that email, and then the appropriate person will respond to you. Next slide. On the front page of our website, there's a navigation panel on the left, circled in red here, and most of the information provided today in this presentation can be located on our website. Some of those key tabs on the left include certification standards and data requirements, and then links to other systems as well. Next slide. Each county in Oregon is assigned to either Karen or myself. The SBHC site coordinator should always call or email their assigned public health nurse, and as their first and foremost way to reach out to the state. You can find this map on our website. You can see that I have the green areas and Karen has the blue areas in the state. Also on our website is the recertification checklist tool that has key dates on the left-hand side, and a checklist to prepare for a site visit on the right-hand side. Next. The suggested practices document that mirrors the standards for certification is also on the website, and it's meant to provide some basic guidance to the standards. The document refers to other documents, websites, and resources to help support your efforts. So, for example, if you are wanting guidance about youth-friendly clinics, you just got some, but also you can find that section in the suggested practices document for related resources. Karen and I reviewed this document once a year to make sure it is updated and the links are current. I think as Kate mentioned, our office publishes an annual report about Oregon SBHCs every year, and we distribute this to partners, including SBHCs. It's a great resource for you to use to spread the word about SBHCs, or if you're writing a grant. It also goes to legislators. Next slide. These fact sheets are a combination of information from the operational profile, encounter visit data reports, and the Oregon Department of Education. Each SBHC gets their own customized fact sheet sent annually to the coordinator by the end of the calendar year. And then we have these brochures online. We can also provide you with a hard copy if you would like, both in English and Spanish. They're great to hand out at fairs, school events, or in your waiting room. They provide answers to the basic questions like what's an SBHC, how can an SBHC help, who can go, why go, payments, things like that. So if you want hard copies, you can certainly get in contact with us and we can send them out to you. We have 3 meetings every school year for site coordinators. There's an in-person meeting in October. That one is coming up on October 11th this year. We have a lot of people coming. Looks like it's going to be great. We have some panels, and it's going to be pretty.
10.
Oh, sorry. They're looking at me. I'm sorry. It's the 10th. So we try to focus this meeting on networking with others and hearing about what sites are doing and what's happening in adolescent care in Oregon. And then we put on 2 online webinars. This one is not included. There's the sort of winter one and spring one, and those we provide updates on things going on here at the state and things like that. So there are also opportunities for us to provide trainings as they come up during the year, sort of like this one, and then other trainings that we'll send out to you. Next slide. So youth action councils. Karen touched on that a little bit. So what are YACs? They are youth advisory councils, or basically youth-driven groups that focus on advising, supporting, and advocating for SBHCs and their services. And approximately half of our SBHCs have a YAC. Some of those are supported by SBHC staff, and others are funded by various grants available. Our office has several toolkits pictured here on the slide that can provide direction for you to build and grow a YAC at your SBHC. And you can also connect your SBHC with other SBHCs so that they can learn from each other on how to sustain a YAC in an SBHC. Slide. Okay, so we've gone over a lot of information, and now we just want to review the calendar one more time. So what does your school year look like chronologically in relationship to certification? Key dates: July 15th for data reporting and mental health grant reporting, October 1st for the operational profile, and October also for the in-person coordinators meeting. Winter coordinator webinar. January 15th is a big date for mid-year data reporting. Satisfaction surveys are due, and mental health mid-year report is due. And then there's a spring webinar, and then June 30th is satisfaction surveys are due. And of course, we here at the State Program Office are also a resource to you. We hope that we are. Contact us anytime. We're here to help you. And don't hesitate to reach out to us for anything. There is our one email where you can reach us all, and then I think a lot of you have our other emails if you need to reach out to us personally. I think that's it.
Any questions?
Oh, we got a little kudos on there.
These all. Yeah.
Okay, so if there aren't any other questions right now, again, just contact us and we will have this up
In a couple weeks.
in a couple of weeks.
Mm-hmm.
And we will search out people that hopefully we can get this to as well, that weren't able to attend. That's it? Okay.
I think that's it. You get an extra half hour, I think.
Yeah, we weren't sure how long it would run this year, so you have a free half hour.
Yay!
Awesome.
Thank you
Thanks,
all.
all right, thanks.
Thank you.
Bye.